to assess the health status of a country or in a state, we use some indicator. Indicator means is the measuring stick by which we can assess whether health condition of a country is improving or it is decreasing. That means, as for example, the crude birth rate, crude death rate. Crude birth rate means how many people are born per 1000 population in a year during a particular area. So, in a particular area, if in a given year total number of live births, if it is 30, that means 30 live births per 1000 people in a year. Say after 5 or 10 years, the birth rate is reduced to 20 per 1000 live birth. That means the health condition is improving. Why? Because of better healthcare facilities, mothers are availing the health services in a better way. That means they are spacing their children by adopting the various family planning methods like use of copper T or permanent method of sterilization, that is tubectomy or vasectomy, or use of condoms. So, by means of adopting various measures to limit the number of children in the family, the birth rate has reduced drastically from 30 to 20. So, it is a good sign. Indirectly, it reflects the health condition of a country. Why? If we do not limit our family size within say 10 years or 20 years or 30 years, the population will increase, but our resources are limited. Resources means money, material, manpower. So, your land is limited, your for development purpose, your fund is more or less limited. So, you cannot expand your land area, you cannot expand your incomes in a massive way, you cannot provide fuels, electricity in a massive way. So, within the limited resources, you have to provide basic needs of the people in a country. Basic needs means food, shelter, clothing, education. So, these are the basic needs. So, to meet the basic needs, the resources have to provide these needs, but if the resources are limited, you cannot cope up the situation by providing basic needs to the enormous people. So, that is why population control is urgently needed. So, today's topic is demography of India. What is demography? Demography, it is the scientific study of human population. Scientific study of human population. It is the scientific study of human population. Why this study is needed? Because we have to know the population size. We have to know the population size. We have to know the composition of the population. Composition means male, female, sex ratio. What is the various age groups of people in India or in the world? What is the language the most of the people are using? What is the literacy rate? What is the dependency ratio? See, these are the important indicators. So, first of all, the size of the population, that means number of people living in our country or number of people living in the world. So, one is size, next is its composition. Its composition means what percentage of people are male, what percentage of people are female, what is the sex ratio, what is the literacy status, what is the language, what is the caste system. So, these are the various areas which we can analyze by doing the qualitative study. So, one is size of the population, it is the quantitative study, how much, it is a quantitative study, but when we go in depth, sex ratio or ratio of male and female or the total under 5 children or the literacy rate, these are the in-depth study, that is the qualitative study. Next is the density of the population. What do you mean by density? Density means how much people are living per square kilometer area. Per square kilometer area, how much people are living. Roughly it is, as per 2049 census, density in India is 394 per square kilometer. 394 per square kilometer. Now, what are the important health impacts if there is enormous increase of the human population? First of all, there will be impact on housing, impact on housing, impact on environment, impact on vector-borne diseases. Why? If we cannot provide shelter to most of the a certain percentage of people, they will start living here and there. You have seen the various slums near on the high road side or on the railway side. So, there will be rampant eruption of slums. And what is the problem? As the slums are erected here and there without any scientific basis, there will be blockage of the drains, particularly during rainy season. And the most of the people have got little facilities for disposal of the waste material. They are throwing the waste material indiscriminately, and also drainage facilities are poor. So, there will be stagnation of water here and there. As a result, there will be breeding place of mosquitoes. Vector-borne disease means mainly there are malaria, dengue, chikungunya, Cholera. These are the also the Malaria. These are the important vector-borne diseases. These diseases are transmitted due to bite of the infected vector. So, vector means mostly the mosquitoes and also the sandfly. So, these are the important vectors which transmit the disease from one person to another. So, if there is slums here and there will be pollution of the soil, they will defecate in the open air, there will be scarcity of safe drinking water. As a result, they will suffer from various waterborne diseases like diarrhea, dysentery, MBBS, giardiasis. So, these are the important waterborne diseases and typhoid. So, due to drinking of or due to scarcity of safe drinking water, various waterborne diseases will develop among them and they will suffer from malnutrition. Why? Because most of them are illiterate and they have low earning capacity. That is why their under 5 children will suffer from various types of malnutrition. As a result, they are more prone to various types of infection, because in case of malnourished children, their immunity is low. So, that is why they will suffer from various communicable diseases. So, in this way, they will suffer from various morbidities. What is morbidity? Morbidity means any departure from normal health. Any departure from normal health. Normal health থেকে যদি আমার কোনো abnormality হয়, that is morbidity. So, they will suffer from various morbidity. It may be malaria, it may be cholera, it may be typhoid, or it may be dengue, or it may be sexually transmitted diseases. So, these are the important communicable diseases which are transmitted due to rampant eruption of slums here and there. So, that is why the enormous growth of the population may lead to physical hazards, and also psychological hazards in the form of anxiety, stress and strain. If the people suffers from anxiety, he may develop hypertension. After 10 years or after 20 years, he may develop hypertension. He may develop diabetes, or he may develop various neurological symptoms. So, these are the psychological problems due to explosive growth of the population. Another is, there is chance of suicide, homicide. There is chance of theft and dacoity, because they have no earning capacity. Most of them are unemployed or earning a bigger amount. That is why they may adopt unfair means by dacoity or by doing theft. Also, antisocial activities are also more, because most of them are illiterate and they may indulge in drug abuse, gambling, drug trafficking. So, these are the antisocial activities which may increase due to enormous population growth in a country. And also various other diseases like malnutrition, road traffic accident, because they are staying near the highway, near the railway track. So, that is why there is more chance of road traffic accident, there is more chance of malnutrition, more chance of vector-borne diseases. So, these are the various impacts due to enormous growth of the population. Now, what is growth of the population? So, before that, I will say, in the demography there are two parts. One is population statistics. One is population statistics, another is vital statistics. One is population statistics. In the population statistics, you will consider the size of the population, its composition, that means age, sex composition, sex ratio, literacy status, languages they use, caste, So, these are the, one is size, next is composition, next is density. Density of the population. Why density of the population is important? Because in the urban areas, density is more in comparison to rural area. So, many people are shifting from rural area to urban area because of better opportunities, better employment opportunities or better education opportunities. So, many people are shifting from rural to urban area. So, thereby there is more number of people are staying in the town area, and as a result there is more chance of hazards, various types of hazards, health hazards that I have already mentioned due to overcrowding in a city or in a metropolitan area. So, these are the important population statistics. Another important population statistics is the dependency ratio. Dependency ratio. Another is literacy. Dependency ratio and literacy. What about vital statistics? Vital statistics is, one is death rate, another is birth rate, another is marriage rate, ঠিক আছে? Next is life expectancy at birth. Another is growth rate. Divorce. So, these are the important vital statistics. One is birth rate, one is death rate, one is marriage rate, life expectancy at birth, growth rate, divorce. Clear? So, let us discuss about population statistics. Size. Hey, এটা কই? Trend of population worldwide. In the after the birth of Jesus Christ, the Christian era started. So, after the birth of Jesus Christ, the worldwide population was 250 million. 250 million means 25 crore. After 1800 years later, it became 1000 million. 1000 million means 100 crore. 100 crore means 1 billion. So, in the Christian era, worldwide human population was 250 million or 25 crore. After 1800 years, after 1800 years, it became 1 billion. Clear? After 130 years later, it becomes 2 billion. Again, after 30 years, it became 3 billion. Clear? After 15 years, it became 4 billion. 4 billion means 400 crore. Again, after 12 years, it became 5 billion. Clear? Again, after 12 years, it became 6 billion. Clear? Next is in the year 2014, it became 7 billion. It is roughly 15 years. And now in 2025, it is 8 billion. So you see how the size of the population is increasing day by day. The start of the Christian era, it was only 250 million or 25 crore. But after 1800 years later, it became 1 billion or 100 crore. Next, doubling was done after 130 years, that is 2 billion. Next, after 30 years, it becomes 3 billion. Then again, it was 4 billion after 15 years. Then after 12 years, it became 5 billion. Then again after 12 years, it became 6 billion. Then after hardly 15 years later, in the 2014, it was 7 billion, and after 11 or 12 years later, in 2025, it became 8 billion. So you see how the world population is increasing day by day. So your land area is limited, your resources are limited, your ocean, your ponds, all are limited, your agricultural land is limited. So how will you afford the basic needs of the people if the population growth you cannot check? So you have to check the population growth. How? Achha. It is the world scenario. If we consider what is the scenario of population size in India in 1901, because census is done at every 10 years. It was roughly 238 million. 238 million. So it became almost double after 130 years. It becomes double. ঠিক আছে? Sorry, not after 30 years, after 60 years. After 60 years, it becomes double. Again, it becomes double after 30 years. After 30 years, again it becomes double. So 1901, that you add 60, that means 1961. 1961, it becomes double. Then again you add 30, 1991, it becomes double. In 2000, on 5th May, 11th May, on 2011 May, it came to 1 billion. It crossed 1 billion. 1 billion means 100 crore. Clear? May 2000, it crossed the 1 billion mark, and it is projected that in the year 2020 2050 it will be roughly 1.53 billion. It is projected that if the population growth continues at a rate of 1.3%, it will it will be round about 1.53 billion by 2050. What is the data in 2025? 2025 roughly 140 crore. 2025 data is roughly 140 crore. So, after 2050 the projection is roughly 1.53 billion. So, you see how the population growth are gradually increasing. As a result, total size of the population is increasing day by day. That is why we have to control the population. How? One is how you have to control the population growth. What is population growth? Birth rate minus death rate. If your birth rate, roughly suppose India's birth rate is roughly 20 point something. If we say 20 means 20 per 1000 people. India's birth rate is 20 per 1000 mid-year population in a year. 20 per 1000 population, mid-year population in a year. So, India's birth rate is 20, death rate is roughly 7.5 per 1000 mid-year population in a year. So, birth rate minus death rate কত হচ্ছে বলো? তাহলে এটা পার 1000 বলেছি, তাহলে এটা যদি পার 100 করো 1.25%, এটা হচ্ছে গ্রোথ রেট। গ্রোথ রেট ইট ইজ এক্সপ্রেসড ইন 100 পার 100, কিন্তু বার্থ রেট ডেথ রেট পার 1000 মিড ইয়ার পপুলেশন মনে রাখবে। তাহলে বার্থ রেট মাইনাস ডেথ রেট দ্যাট ইজ দ্য অ্যাকচুয়াল গ্রোথ। তাহলে অ্যাকচুয়াল গ্রোথ রেট ইজ 1.25 পার 100 পপুলেশন, বোঝা গেল? তাহলে 1.25%, হ্যাঁ, বেটার টু সে ইন্ডিয়াস গ্রোথ রেট ইজ 1.25%। আর যদি তুমি রাফলি মনে রাখো, ইয়ারলি 16 million people are adding in India. Roughly 16 million people are adding every year. 16 million means 1.6 crore. Mind that every year we are adding 1.6 crore people. So, we have to control the birth rate. You cannot improve the death rate. How you will reduce the growth rate? Either by decreasing this figure birth rate or by increasing this figure. But we are not in favor of increasing the death rate. তুমি কি চাইবে লোকের মৃত্যুটা বেশি বাড়িয়ে দেবো? হ্যাঁ, ট্রেন অ্যাক্সিডেন্ট করে একটা বড় বোম এক্সপ্লোশন করে ডেথ রেট বাড়িয়ে দেবো? এটা তো আমার কাম্য নয়। তাহলে our intention is to reduce birth rate by improving the education status, particularly female literacy rate. if we improve the female literacy rate, if we improve the economic condition in the society, automatically the people will be alert that yes, we will not take so many children because we have to bring them up properly, proper education, proper employment. So that's why the family size will be reduced automatically. So if you give the opportunities, education opportunities, if you provide family planning services at every place, then the people will adopt various family planning measures and various health services. If you give the proper immunization to the newborn children, so there will be drastic reduction of death of the newborn babies. So if you give protection to your children that this child will live at least 70 years life expectancy, if you give impression among the people that your child will, after birth, your child will lead a long life at least for 70 years, then the couple will be eager to adopt small family norm. That means two child per couple or one child per couple. So automatically the birth rate will be diminished. As a result, if the difference between birth rate and death rate is minimal, there will be minimal growth. So our population, size of the population will increase very slowly, or if it is almost equal, then there will be balance. That means stabilization of the population. Birth rate and death rate, if it is almost zero, then there will be population will be stabilized. Population will be stabilized. But stabilization of population কখন বলা হবে? When the net NRR, net reproduction rate, net reproduction if NRR, net reproduction rate, if it is 1, then the population growth will be stabilized. That means there will be no more growth in the population. Now what is NRR? Net reproduction rate means a newborn girl child will bear during her reproductive period, net reproduction rate means number of female child a newborn baby will bear during her reproductive period if she adopts, or if the age specific fertility rate is fixed, then NRR will be 1. That means one girl child will give birth to only one girl child, assuming fixed age specific fertility and mortality. না আমার যখন এখন যা মর্টালিটি প্যাটার্ন আছে বা এজ স্পেসিফিক ফার্টিলিটি যেটা আছে সেটা যদি ফিক্সড থাকে, সেখানে আমার একটা ফিমেল চাইল্ড তার রিপ্রোডাক্টিভ এজ মিনস 15 to 45 years. This period is the reproductive period. So এই reproductive period she will give birth to only female child. That means NRR 1. NRR 1 means আমি একজন মহিলা, আমি আমার লাইফ টাইমে একটা মাত্র আমার মহিলা বাচ্চা হলো, সেই বাচ্চাকে আমি লালন পালন করলাম, তাহলে কি হলো? রিপ্লেসমেন্ট লেভেল ফার্টিলিটি হয়ে গেল NRR. দ্যাট মিনস আমার এই যে স্ট্যাবিলাইজ পপুলেশন আছে সেই পপুলেশনের সেম থাকছে, দ্যাট ইজ NRR, net reproduction rate. Net reproduction rate means number of female child a newborn girl will deliver during her childbearing period, assuming fixed a specific fertility and mortality. Assuming fixed a specific mortality and fertility. ঠিক আছে? আচ্ছা, তাহলে NRR 1, তাহলে if NRR 1 there will be population stabilization. If it is more than 1, that means there is every possibility of growth of population. If NRR less than 1, it is less than 1 হয়, then there will be minus growth of the population. That means after 10 years or after 20 years, population, number of population will be diminished. কোন কান্ট্রিতে আছে মাইনাস পপুলেশন গ্রোথ? জার্মানি, হ্যাঁ, হাঙ্গেরি, জার্মানি, হাঙ্গেরি, এগুলো হচ্ছে গ্রোথ হচ্ছে মাইনাস। হ্যাঁ, আচ্ছা, বিফোর দ্যাট let us discuss about the demographic cycle. There are 5 stages in the demographic cycle. One is high stationary. High stationary, early expanding, late expanding, next is low stationary, and last is declining. তাহলে ডিক্লাইনিং কখন হচ্ছে? when there is minus growth. কোন কান্ট্রি? জার্মানি, হাঙ্গেরি। কেন? here birth rate is less in comparison to death. death বেশি হচ্ছে, বার্থ কম হচ্ছে, that's why there is minus growth. So it is a declining stage. Next is high stationary. কখন? হাই স্টেশনারি, বার্থ রেট বেশি, ডেথ রেটও বেশি। বার্থ রেট বেশি, ডেথ রেট বেশি, মাইনাস করে দেখা যাচ্ছে 0 হয়ে যাচ্ছে। হ্যাঁ, ইন ইন্ডিয়া বিফোর 30 or 40 years before independence, there was high birth rate and high death rate, resulting in almost stationary growth. There is no growth. Why? There was more chance of famine, more chance of epidemics like cholera, like plague, like floods, and health facilities were very poor. That's why more people was delivered, but their lifespan was shortened due to various reasons. It may be natural calamity, it may be epidemic in every year, floods. So as a result, birth rate and death rate were almost equal. So high birth rate and high death rate, but effectively growth rate was almost 0. This is called high stationary. Before 1921 in India, birth rate and death rate was almost equal. So this is the high stationary stage. After that, early expanding. Early expanding means birth rate remains same, birth rate বেশি আছে, কিন্তু death rate starts declining. Death rate যেটা high death rate ছিল, it starts declining, but birth rate remains more or less same. As a result, there is growth of the population. So, most of the African countries and also Asian, many Asian countries were in this stage. After 1921, India was in the early expanding stage. Next comes the late expanding. Late expanding. At present, India in this stage, in the late expanding stage. Late expanding stage means death rate starts declining, but birth rate falls more rapidly. Birth rate falls more rapidly, but death rate also started declining. As a result, the growth rate is not like that of the early expanding stage. Growth rate is there, but it is to some extent slow growth rate. That is why there is late expanding. Total population is increasing because difference between birth rate and growth rate is in the positive side, not in the negative side or not in the zero side. That is why it is the late expanding stage. India is in this stage. Next is low stationary. Low stationary means birth rate and death rate are almost same. Birth rate and death rate are almost same. Most of the European countries, their birth rate and death rate are almost zero. Denmark, Switzerland, the birth rate and death rate are almost same. That is why there is low stationary. But actually, even after attaining the NRR, even after attaining the replacement level fertility or even after attaining the stationary stage, the population will not, suppose if you consider this graph, population is increasing, here NRR, net reproduction rate, you have achieved 1, that means there is stabilization of population, but this population will not be halted immediately. It will take some time to diminish. Why? Because it is like the traveling in a train. When the train starts, it starts slowly, but when it gains momentum, it will take some time to halt. So, population growth is like the travel in a train. Initially, it will grow slowly, but when it takes the momentum, it takes, even after stabilization of the population, it will take some time to reduce the population growth, because the number of children who have been delivered, say some are infants, some are under 5 children, some are adolescent. So, these group of people will grow after 15 years, after 20 years, and they will be adult and they will produce children. Naturally, the growth size of the population will not be diminished immediately. It will take some time to diminish the size of the population. So, it is like moving in the train. So, train is running in a full speed. So, it will not immediately halt. It will take some time to halt in the station. So, it is like a momentum of a train. So, our motto is to reduce the size of the population. So, if we can stabilize the population, our population will diminish in near future. So, in the demographic cycle, what are the stages? There are 5 stages: high stationary, early expanding, late expanding, low stationary and declining. These are the 5 stages. So, you must remember the demographic cycle. What is the growth rate in, what is the growth rate in India? It is roughly 1.25% growth rate. Now, what is the life expectancy in India? Life expectancy in India is roughly 69 years. Male and female average, male hardly 1 year more in comparison to female, female 67 or 67.5 years, and in case of male it is 69 years. So, roughly it is 69 years. Life expectancy at birth is 69 years. Next is why the death rate has diminished. Death rate, worldwide death rate is roughly 8 per 1000 mid-year population. Previously it was 11 per 1000 mid-year population. In after say 30 or 40 years, it has come down to 8. What is the figure in India? India growth rate is roughly 7.5 per 1000 mid-year population. Previously it was 14.1. In 1980 it was 14.1, and in 2012 the crude death rate is 7.5 per 1000. Crude death rate is roughly 7.5. Previously it was 14.1. What is the figure, worldwide figure? Previously it was 11 per 1000 mid-year population, and in 2010 it came down to 8 per 1000 population. So, why the death rate is diminished? Because of more facilities, health infrastructure has improved, awareness level has also improved, literacy status has also improved. That is why the death rate has diminished. Also, the most of the deaths are due to death of the under 5 children, and also death of the infants. Infant means the newborn babies up to 1 year. So, reduction of the infant mortality and also the child mortality by means of improving the MCH care services. MCH care means maternal and child health care services. Mothers are attending hospitals for antenatal checkup, they are giving various advices, and at risk mothers are advised to get admitted at least 2 weeks or 1 month before delivery. That is why maternal death rate has also reduced, and also the death of the newborn babies has also drastically reduced. And also apart from this, various immunization services, under 5 children are giving various vaccines like BCG, like diphtheria, pertussis, tetanus vaccine, pentavalent vaccine, measles vaccine. So, these are the important diseases like tuberculosis, whooping cough, diphtheria, neonatal tetanus, measles. So, these are the important diseases which can be prevented by means of administration of various vaccines to the infants and also to the children up to the age of 5 years. And also by providing the ORS to the children who are suffering from diarrhea, and also by giving various types of antibiotics to the children who are suffering from pneumonia. So, by delivering this type of vaccines and also by giving various modern facilities to children, the infant mortality and child mortality rate has drastically reduced. As a result, there is reduction of the death rate. Clear? So, you have to reduce death rate. Side by side, you have to adopt various family planning measures. You have to educate the people, especially the literacy rate among women, and also improvement of the socio-economic condition. It has been found that the people who are more literate, the people whose living conditions is better, whose economy or employment opportunities are better, their children are limited. So, if we can provide literacy, if we can improve the social condition, if we can provide various family planning measures to the eligible couples, automatically the birth rate will also be diminished. So, if we can limit the number of children in a family, automatically there will be reduction in the birth rate. As a result, there will be stabilization of the population. That means birth rate and death rate are almost equal. So, we are trying to enter into the late expanding stage. Low stationary. We are trying to enter into the low stationary stage. Clear? So, our motto will be to enter into the low stationary stage. That means birth rate and death rate will be almost equal. As a result, there will be no population growth. Clear? So, if we can control our birth rate, naturally we will be able to enter into this demographic cycle, that is the low stationary stage. ঠিক আছে, আজকে এইভাবে থাক। ডেমোগ্রাফি চ্যাপ্টারটা, you go through this demography chapter, otherwise it will be difficult for you to materialize, because you are the second year students, so you do not know what is mortality, what is morbidity. This mortality, morbidity, infant mortality, child mortality, maternal mortality, these chapters have been elaborated in the health chapter. So, I do not know whether health chapter was covered or not. So, you have to read the various mortality and morbidity, and after that we will go through this demography chapter. So, it will be easier for you to grasp. So, demography means, in a word, it is the scientific study of human population. Why we should do the scientific study of human population? Because we have to know the size of the population. If we do not know the size of the population, if we do not know the birth rate, if you do not know the birth rate, how will you plan for healthcare delivery services? How many schools are needed? How many hospitals are needed? How many specialist hospitals are needed? How will you calculate if you do not know the exact figure? If the death rate is high, you have to reduce the death rate. So, that is why you have to build the various hospitals, various specialist hospitals. If the road traffic accident is more, you have to employ the orthopedic surgeon, you have to give modern equipments for modernization of the orthopedic department, or you have to erect the trauma center. Nowadays, road traffic accident is increasing day by day. So, trauma centers are coming up day by day. But in West Bengal, trauma centers are very few, very limited. If you ask your friends, you will find that many times there is rush in the emergency department. Many young people are being admitted with various multiple fractures, head injuries. But as there is no trauma center in most of the hospitals, we are losing the precious life of young people due to road traffic accident. So, if you do not have the data how will you plan? How will you tackle the situation? So that is why we have to know the demography of the people, and demography is always changing. There is changing in the demography. Why? Because of changing in the scenario, death rate decreasing, birth rate is not decreasing in that proportion. That is why there is imbalance between birth and death. So huge population, and those, so huge population, they are rushing for employment, they are rushing towards town for better opportunities, but our resources are limited. So there is a chaotic situation. That is why we have to limit the number of children, we have to control the population, we have to stabilize the population. Clear?